Yeah, hi winners. Now I'm here to go with some quick recap, uh, which are very important in examination point of view. So first about the burrs and their dimensions: 245 burr. The length is 3 millimeters, diameter is 0.8 millimeters, and the main usage is occlusal convergence. And the smaller version of this burr is 330 burr, which is used in the pedo patients, and the head length is 1.6 millimeters. Burrs that are used in the inlay preparation are 271 with a diameter of 0.8 millimeters, 169 L burr, where L stands for long, that is 0.5 millimeters in diameter, and as it is long, it has more length, that is 5 millimeters, basically used to prepare the dovetails and the bevels. And next about the hot tissue lasers, which are used to cut the dentinal structure. So make a note about these two hot tissue lasers. And of course, you have a question on the CO2 laser, which helps in the pit and fissure sealants. Of course, we have shared the notes related to the lasers. Lasers are very important. So please do go through the notes of lasers, which is very important part. A few important basic related questions. That is type of hypersensitivity that is shown by anthrax phenomenon is type 3. Of course, you know type 1 is atopy anaphylaxis, which is mediated by IgE immunoglobulins. Whenever tetanus toxin is given antenatally, okay, it's going to protect both the mother as well as the children. Midday meal is going to occupy one half of the protein content per the body and one third of the calorie content of that particular day. Clotting factors, sorry, clotting factors which are decreased in the pregnancy are 11 and 13, whereas which are decreased in the stored blood are 5 and 8. Shrinkage lung is a feature that is seen in the case of SLE. If you want, you can add butterfly rash is also seen in the case of SLE. 17D vaccine is used to cure yellow fever. Most heat sensitive vaccine is OPV. And the vector which is used in transforming the disease, that is trench fever, is Lewis. And the minimum concentration of the fluoride for the disinfection of a drinking water is 0.5 milligrams per liter, whereas in the case of disinfection of swimming pools it is 1 milligram per liter. It's already discussed on the group. Pulse polio immunization first started in India in 1995, and the communicability is best measured by secondary attack rate. Okay, so the age consideration for the marriages in India, for the females it is 18 years and the males it is 21 years. I hope you are very good you're very good at this. This is a very important area where you can get decent number of questions. If you're not perfect with this, go back and check this hypersensitivity video that is there on MDS Conquer channel. So that's going to help you out in solving many questions. Okay, so I'm just going to give a rough idea. That is type 1 IgE mediated anaphylaxis atopy. Type 2 is cytotoxic or cytolytic mediated. Okay, so these are the examples, which is mediated by GM. And type 3 is immune complex mediated. These are the two favorite examples. Again, it's GM. Type 4 is delayed hypersensitivity. These are the two favorite examples, and it is mediated by the T cells. Scintigraphy, which is one of the modality in the case of your nuclear medicine, and the material that is used most commonly, they will ask a question over this, that is TC99M, is a dynamic and a minimal invasive diagnostic tool to assess the salivary gland function and to determine the abnormalities in the gland uptake and excretion. Okay, this is basically a pure gamma rays. Okay, pure gamma rays are emitted from this nucleotide, which helps in diagnosis of the ductal obstructions or siloliths or any sort of abnormalities can be used in identifying. Next, about the elastics, this is the orthodontics part. So class 1, class 2, class 3 elastics. So class 1, they are intra-arch elastics, which are stretched between the molars and the anteriors. Okay, they are generally used to close the spaces and retraction of the teeth. Whereas class 2, they are inter, means they are from one area to other area. So they stretch from the lower molars to the upper anteriors, and they are used in the treatment of class 2. So class 2 useful in the treatment of class 2 malocclusion, whereas class 3 are quite opposite to that of the class 2. They stretches from the upper molars to that of the lower anteriors. They are used in the treatment of class 3 malocclusion. Okay, so please, these two areas are very important. Class 1 is intra, class 2 and class 3 are intermaxillary, whereas class 2, it stretches from lower molars to that of the upper anteriors, whereas class 3 stretches from upper molars to that of the lower anteriors. Next few important things about air abrasion. I hope you're very good at this. Basically, I mean, you can go through the underlying stuff. Basically, the important things are the material that is used, that is aluminum oxide, and the particle size is 2 to 25 to 30 mm. But recently they have tried biogas has been used in the place of aluminum oxide, and the normal exit pressure of this is 60 to 120 pounds per square inch in a conical manner. Okay, the distance also increases as the distance between the nozzle tip and the tooth increases. If you want, you can go through how the preparations will be. For example, if you see, the internal line angles are usually round by air abrasion. Generally they are rounded. Line angles are rounded in this preparation, but however, if the tip is placed within 1 millimeter from the tooth surface, the internal line angles can be sharp. Similarly, in the case when the bevel preparations are required, the nozzle tip should be kept at a distance of 5 millimeters. For the preparations which requires a butt joint, the tip should be placed 1 mm from that of the tooth surface. So these are the difference. Like if you change the distance from that of the tip of the instrument to that of the tooth surface, there will be modification in the preparation. So what modification at what distance, make a note. It is important. Next one is a few important questions about bonded amalgam. So basically, the main reason why they have tried this is to increase the bonding between the amalgam and the restoration, because the retention of amalgam is basically a mechanical retention. So they wanted a bond between the tooth surface. So all these have tried. The first thing is they painted the walls of the cavity with a layer of zinc phosphide cement and then condensed amalgam over that wet surface. That is the first they have tried. Then after, they have tried a technique called a selective interfacial amalgamation liner, which is just a combination of polycarboxylate cement and amalgam alloy particles. The strength they have gained is 2.4 MPa, which is not sufficient and not desirable. Then they have tried a different thing that is called as bonded amalgams. So these bonded amalgams examples, these examples are important. One is 4-META and the second one is MMA-TBB. Okay, so these two are an important examples of bonded amalgam. Of course, you can go through the slide. Okay, everything is clearly given, but basically the confusion area is the sinus, okay, helps in baroreceptors, whereas the carotid body helps in chemoreceptors. Okay, so next is about the markers of the B cells. The B cells markers are CD10, CD19, 20, 21, 23 and CD79A, whereas the markers of the memory T cells are CD45RO, whereas markers of NK cells are CD16 and CD56. Done for now. I will be coming back with some more important stuff in the next video.